Hello, I'm Dr. Helen Pensanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a skin condition that goes beyond the surface, psoriasis. You've probably heard this word. Maybe you know what it is, maybe you don't know what it is, but it affects millions of people. And it's more than just a rash. It could be an itchy, painful, and emotionally distressing situation. But here's the good news. It's manageable. With me today is someone I deeply respect in the field of regenerative medicine and integrative care, Dr. Bryn Henderson, a board-certified physician known not only for his clinical expertise, but also for his dedication to whole person healing. Dr. Henderson, welcome to Doctor.
Well, thank you. Happy to be here.
Doctor, you've helped countless patients find relief from psoriasis, which is a chronic condition. So let's talk about how you have combined evidence-based Western medicine with cutting-edge therapies. So what is psoriasis really?
Psoriasis starts in the immune system. Surprise, surprise, not the skin, but its effects show up on the skin. Psoriasis leads to the thickening of the outer skin layers. The keratin layer builds up rapidly, forming white and silvery scales. You'll notice the epidermis thickens, and then the dermis beneath it becomes inflamed and rich in dilated blood vessels, which is why the plaques look red. The skin is essentially turning over too fast. What should take weeks is happening in days, leading to scaly, irritation, and discomfort. Psoriasis is a long-term autoimmune disorder that causes your skin cells to multiply way faster than normal. Normally, your skin cells renew every few weeks, but with psoriasis, this happens in just a few days. The result? Thick, red patches covered in white or silvery scales. They can itch, sting, or crack, but here's what's important to know. It's not contagious, and it's not your fault. It's an immune system being overactive.
All right, so I'm going to ask you, what's the difference between eczema and psoriasis?
Psoriasis is a full-body disease with immune involved at its core. While it shows up on the skin, it's linked to inflammation throughout the entire body. That's why people with psoriasis have higher risks of diabetes, heart disease, and depression. In some, it even affects the joints, a condition called psoriatic arthritis. And a little later, I'll give you a good example of that.
All right, so you told us what it looks like, and my question was, how and what's the difference between psoriasis and eczema? Because they're both dry, flaky. This actually, you talked about having plaque, which eczema doesn't. But can someone have eczema, but they really have psoriasis?
Eczema and psoriasis have a common origin. There are some key differences between the two conditions. Eczema is more common, especially among children. Eczema rashes tend to be itchier and affect skin folds, like in the elbows and behind your knees. Psoriasis tends to be thick.
Okay. All right. So now that we know there is a difference, let's hear about what the classic signs of psoriasis is once again.
The classic signs are those itchy, red patches with white scales, usually on the elbows, knees, and lower back and scalp. But it can also show up as small red dots after an infection or smooth red areas in the body folds, like under the breast or around the groin. In the nails, you might see pitting or discoloration. And if the joints are involved, there may be swelling, stiffness, and especially in the fingers and the toes.
Is this genetic?
There's definitely a genetic component. About a third of the patients have family members with psoriasis, but it's not just the genes. It's triggered with stress, infections, cold weather, and some medications. Even skin injuries like cuts and sunburns can make it worse. It's a mix of an inherited risk and with outside triggers.
All right, let's talk about a patient that you have seen recently and tell us about what you did for that patient.
Okay. He was a 45-year-old officer, and he came in with large, scaly plaques on his elbows, knees, and back. He said he'd been going through the worst months, and he also said he had some nail changes, pitting and yellowing, but no joint pain. He was understandably frustrated. It was affecting how he dressed, how he slept, and even how he socialized. After some tests, we diagnosed him with a moderate plaque psoriasis.
All right, and what was the first thing you did to treat him?
The first thing we did is we gave him some topical steroids with vitamin D ointments to give him some relief of his skin. And we were able to ease itchy and the pain. We added some phototherapy using the UVB light, and that was very effective, and it's safe. It's not a medicine.
Can people have this UVB light at home, or is it just in a doctor's office?
No, they can have it at home. And in fact, sometimes if you can get them on a regime for prevention, they can control a lot of the psoriasis by using it at home. So we started him on another medication because it was so severe. It was called methotrexate. And that oral medication helps calm the immune system, and he didn't have to take it long. But we didn't stop there. We looked at his diet, his stress, and his activity. We looked at it because it affects the whole person.
So how fast did he improve? Is this one of these 6 to 8 week things or what?
No, he had relief of some of the symptoms within days, and within a month he had less itching and redness, and by 6 months the affected areas of his skin went away.
Wow.
And he told me he was sleeping better, wearing short sleeve shirts again, and feeling more like himself. It was a huge transformation, and it came from treating the skin and the immune system.
All right, so now let's get into our favorite, which is the new regenerative medicine treatments.
There's a number of them. The biggest game changer in our office has been the use of PRP. We had a lady that was about 60 and was unable to walk because of the psoriasis arthritis in her ankles. So what we did is we took the platelet-rich plasma, spun her blood down, and extracted the plasma from the top, and then injected it in those joints. And she was walking pain-free within about 3 to 4 days. And so it was like a miracle. And it wasn't just unique to her, because subsequently, after that, we used PRP to treat the joints of any other psoriatic patient with psoriasis and arthritis caused by it. And it was a very consistent response. So we were able to restore their balance a natural way by utilizing their own platelet-rich plasma.
Did you add those peptides that you like to use?
No, the first lady, we didn't add the peptides, but sometimes patients don't have time to wait for us to draw the blood and spin it down. So then I just used a quick fix for peptide. You can just drop in a syringe and pop it in, and that is extremely effective.
I'm so glad you're flexible with people's time management going to a doctor, because a lot of people come on their lunch hour, or they take off from work and they've got to get back, or they're going to lose money. So you are flexible with that. Let's move on to traditional Chinese medicine. What do they have?
They have a method by which they get the body back into balance. So psoriasis is believed to be a sign of internal imbalance, especially involving the liver, spleen, and kidneys. So acupuncture and herbal therapies help restore the energy flow, or the qi. Clinical studies have shown that combining traditional Chinese medicine with Western medicine actually improves outcomes, especially in the hard to treat cases. It's a good example of how Eastern and Western medicine can work hand in hand.
Is psoriasis curable?
Not yet. It's very manageable. And in some cases, because of CRISPR and other gene editing, you could actually cure it. But it's few and far between. I have read of 2 cases in which CRISPR was used to edit the gene and therefore eliminate the psoriasis.
Can you explain CRISPR? I mean, I kind of heard it was like a spell check, situation with the DNA, but can anybody have CRISPR done to their DNA?
CRISPR is a technically sophisticated therapy in which you utilize a viral or other vehicle to get a change in someone's DNA. Now, can anyone have it? I'm not so sure that's taking place yet, but it's definitely on the horizon, and it is creating wonderful help. Take the sickle cell and you can change somebody from having sickle cell anemia not to, or from asthma not to, or psoriasis and not to. That's a big deal.
That's great. What's the one message you want to leave with our patients who are dealing with psoriasis?
You can absolutely live well with it. And when you take the whole person approach, the medications help, sure, but the lifestyle really matters just as much as we encourage patients to follow. We utilize the mnemonic. It's called Psoriasis, a gentle, holistic guide they can carry with them every day.
All right. What does the P stand for?
Protect your skin. Use moisturizers and avoid skin injuries.
S.
Sunlight in moderation. A little sun can help, but avoid burning.
O.
Always for ointments and topicals, stick to prescribed creams and treatments.
R.
Is relax and reduce stress. Reduce stress is a flare, so you want to get it reduced.
I.
Identify and avoid triggers, infections and smoking and alcohol, and certain medications. Just avoid any trigger.
A.
Adhere to your treatment plan. Stay consistent. That's what brings the best results.
S.
Stay healthy inside and out. Good food, hydration, sleep, it all supports healing.
I.
Inform your care team. Communicate the changes and the side effects.
And S.
Support and self-love. You deserve compassion and connection, not shame. This is all doable, and we will help you.
So today we've talked about psoriasis, a skin condition, and we're glad that you joined us. What a powerful conversation, Dr. Henderson. I thank you for being with me on Doctor to Doctor. And to our listeners, if you or someone you love is living with psoriasis, know that there's help and advanced treatments available today. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.